Welcome everyone to our latest edition of the Native Strong Town Hall with Dr. Lyle Ignace of the Gerald L. Ignace Indian Health Center. This is week 63, I believe. Just coming in every week, giving you updates on what's new, what's going on. Lately, of course, it's been pretty centered on vaccinations, or lack thereof, I guess we could say right now. But we do have a pretty big announcement today, and I'll let, of course, Dr. Ignace get to that a little later in the session. If you're joining us via Zoom, you can drop in a couple comments or questions that you may have throughout the session in the chat bubble. We'll get to those at the end of the session. If you're joining us via Facebook Live, you can drop in a comment on there as well, and we'll moderate those questions as we go through. I did want to just mention real quick for those, if you're joining, today we are having our Mental Health Matters drive-through event from 2 p.m. to 6 p.m. at the Gerald L. Ignace Indian Health Center, 930 West Historic Mitchell Street in Milwaukee. So if you're in the area and you want to stop down and see what our behavioral health department has to offer, please do that. Come on down, check it out. We have some giveaways possibly for those who get here early. So yeah, come on down, check us out. And with that, I'm going to pass it over to Dr. Ignace, and thank you all for joining us. And thank you, Dr. Ignace, for doing this yet again another week.
Sure. Thank you, Jeremiah. Yeah, Mark, I had a quick conversation with Mark today. He still had a prior engagement that he's attending to, so hopefully he's having fun and enjoying the afternoon. And next week, I believe, he'll return back, and we'll enjoy his company next week. So I always start off with this slide. It really is a reminder as to the vaccines and what kind of technology these vaccines are based on. I will be talking about the first two, Moderna, Pfizer, as well as AstraZeneca and Janssen. And it's important to understand these vaccines and how they're created, because and how they're generated and produced, because it really does provide a foundation of understanding what, when articles talk about the latest of what's going on, it's always nice to have the kind of that foundational understanding of when they talk about vaccines. It's actually is very important. So the reason why that is I'm sure, I've talked about this a couple times now, and this is really relates to the blood clot disorders that have occurred. And we know this as we've seen it in Johnson & Johnson here, J&J here in the United States. And we also witnessed this as it was occurring with AstraZeneca in Europe. And so what's interesting was that there was an article, and a group of scientists out of Germany actually feel like they've kind of found the link to why this is actually occurring. Now, what I'm going to say is this is more of a theory. It has not been proven, and it hasn't been scrutinized to an expert level. So what I'm going to say is based on theory, at least in their observation, their small sample observation. So as I mentioned, how these vaccines are created is very important, because the mechanism of action is also different in how when getting these vaccines, how it interacts with our body and really gets down to the microcellular level. And that's really where these scientists have kind of devised this theory. So as a result, all vaccines, we get shots, it gets introduced to our arms, and from there it has to go somewhere, and it gets absorbed by the body, and it goes through our circulation. And so the code, the sequence code that the vaccine provides for our body to create an immune response, it's important that how and where this gets generated. So according to these scientists, they feel that um, where this mechanism of development for an immune response lies the critical point as to the why. Now, I mentioned mRNA as a technology base, that is Pfizer and Moderna. So they interact by interacting with the fluid part of the cell. Now, I didn't give a depiction of this, but if you can just imagine a ball, any ball, basically the mechanism of action for a cell would be for the introduction into the ball, and that's where the mechanics of the cell work to create the immune response. Now, each cell, now we're talking on the absolute nano microscopic here of an individual cell. There's all different parts of the cell, and there's also the nucleus, which is the central hub of a cell. So mRNA technology gets introduced into the cell. The AstraZeneca and the Johnson & Johnson vaccine get actually introduced into the nucleus of the cell, the central hub. Mechanisms of function for AstraZeneca and Johnson & Johnson, as they are creating the material for our bodies to identify in an immune response, they feel that the genetic material that is created, it's not perfect. And so as a result, mutant proteins, kind of like if you've ever been in wood shop and you're making stuff and you're sawing stuff, it's all the stuff that ends up on the floor, kind of all the debris, the non stuff that you would want to use. In this case, it's kind of looked at as being the mutant protein that's being created. It is these kind of fragments of production that are made, that are introduced into the blood vessels, and as a result, these foreign entity things of protein mutations our bodies react to that, and cause the clot formation. Now, again, this is in theory. Now, what's the difference between Pfizer and Moderna is the technology of mRNA versus the technology of introducing an adenovirus-based vaccine such as Johnson & Johnson, AstraZeneca. Now, again, this is just a theory. That is what they feel is causing the side effect of the blood clots. Now, speaking of side effects, so another thing that has come up, and I want to bring this up because it's going to be important. We talk about AstraZeneca and Johnson & Johnson. Now we're going to talk about Pfizer and Moderna, and a side effect that is occurring, although they haven't identified an absolute link between vaccine and symptoms, but we've all heard of myocarditis, or people may term it just inflammation of the heart. But this is important because there are causes for this, and it can have its own ramifications if not identified early and treated and diagnosed early in its development. So we know CDC is following a cohort of individuals. They have noticed a small number of individuals, young adults and adolescents, who have experienced this myocarditis. And so a lot of people may be wondering what this is. So here's a picture of a healthy heart on your left. And if you look on the right, the one thing you notice is an enlarged, the enlargement of the muscle, and kind of a red hue in the middle. That's identifying inflammation in the heart muscle. And that's basically what this is. Myocarditis is an inflammatory response of the heart muscle, or called myocardium. Now, when in myocarditis, it can affect your heart muscle. It can also affect the electrical impulses that go through the heart that cause your heart, that triggers your heart muscles to beat. So beat, 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 the normal cycle all is conducted through electrical impulses that signal the heart to squeeze in sequence. So we get blood to the rest of the body and it returns it back. So, but when this gets interrupted or I guess irritated, the muscle can start functioning abnormally, as well as the heart rhythm the conduction of the heart rhythm may actually become affected as well and cause problems. And so that's what we're hearing. I mean, that's what myocarditis is, and this is what the CDC is actively looking at. So what are the symptoms? Now, interestingly enough, the rate of this occurring is about 1 in 200,000. Now, this usually occurs in conjunction with something else. It just doesn't happen out of the blue unless you have some underlying autoimmune problem. But because this happens so infrequently, the suspicion or the general thought is that it does occur, but it occurs in such mild forms that it usually resolves itself in short order before it actually becomes symptomatic. So what I mean by that, and I'll explain this as I go through some of the causes, but the symptoms, as I mentioned, is the inflammation of the heart. It can be mild, it can be moderate, it can be really severe, and cause clinical symptoms. And it's the clinical symptoms is when it becomes the severest. And that's what the symptoms, what these symptoms typically cause would be chest pain. So the lining of the heart, the muscle itself is inflamed. It causes pain, and it causes pain right in the middle of the chest. So it could be right center here, could be a little bit to the left, could be up there, could be in the left shoulder. Now, if it involves the electrical impulses, it can interrupt or delay signals in the nerve conduction, and as a result, we start getting extra beats or abnormal beats or accelerated beats or loop beats, where it then becomes an abnormal rhythm, an irregular rhythm. It's not in sequence, and as a result, when things aren't working as they should, you start having problems with blood flow and pressures that back up into the heart. And when that happens, it's much like when you step on a hose that's running, you step on the hose, what you step and what you see is a backup pressure. And that's basically what happens in the chest and then in the heart. This can result in heart failure. This can result in a weakening of the heart muscle and pressures that go back into the lungs and cause people to be short of breath, even at rest. If the pressures become so significant, it actually can cause fluid retention and swelling in your legs, arms, and ankles, and which can be pretty significant. The most striking is the fatigue part. Because your heart isn't functioning properly and it's weakened, it takes a lot more to generate what it would normally at rest. It would have to function twice as hard or maybe 3 times as hard just to do or maintain a normal level of function. And when it can't keep up with that, our bodies get fatigued and we get weak and we get tired really quickly. Now, much of what I just said sounds kind of familiar, and it should, because the other signs and symptoms that are usually associated with myocarditis, especially with people who have viral infections, are headache, body ache, joint ache, fever, sore throat, and diarrhea. Now, when you look at all those symptoms, including the chest pain, the short of breath, the fatigue, what does that sound like? I mean, it sounds like COVID is what it sounds like. And so there would be a strong indication, more than a year ago when we were first starting seeing a lot of patients come in. They would come in, you know, coming in right away into the hospital with, shortness of breath. They have fevers. They've had chest pains. They're physically wiped out. They have, body aches, headaches, and fevers and sore throat, and they have all the clinical symptoms of COVID. Well, much of what people were coming in, not just only involved the lungs and the injury of the virus that causes injury to the lungs, but there could be concurrent, co-occurring problems going on, including myocarditis. And so there's some overlap of symptoms here to lung issues as well as to heart inflammation. So it's kind of important to understand that these are rare occurrences. Even in normal circumstances, these are rare occurrences. So severe myocarditis is when we talk about not just injury, but what could happen as a result of permanent injury. And it does happen. But again, it's a rare occurrence and not to be expected to occur in every single person who has this, because it's usually mild in its symptoms, and it usually coincides with a viral infection. So heart failure could be a permanent result, a heart attack if blood clot formations start occurring, whether it's in the heart arteries itself or even a clot formation from the heart into the brain. Rapid or abnormal heart rhythms. I mentioned the inflammation, it delays and interacts with the conduction of the heart beats and the signals. And even what we've seen as well is sudden cardiac arrest. Now, we all have watched the news. We all have seen, people who may have looked okay. Yes, we knew they were mildly sick, and we check on them a day later or 2 days later, and we find out that they have passed away. We've seen these stories. We've seen them on TV. We've read about them, and basically people have come up more than likely with sudden cardiac death. Well, what was the cause of that? Well, yes, they'll say COVID on it as a cause, but is it actually COVID to the lungs, or was it COVID to the heart? And time will tell what is the primary cause of individuals, because I know in New York, when New York was kind of the epicenter for all the infections, they would send people home and then follow up check like a day or the next day, and they would find people who've passed away. Well, is that because of the lungs or is that because of the heart? We'll never really know. Time will tell. So when we look at causes, of myocarditis, the list is awfully extensive. But for the most part, the vast majority of causes are typically from viruses. So what kind of viruses are we talking about? We're talking about the common cold virus. We're talking about COVID-19, hepatitis B, hepatitis C, parvovirus. This is the virus that causes kids rashes called Fifth disease. Herpes simplex 6 virus is a cause. Mononucleosis, GI, the echoviruses, rubella, the measles virus, as well as HIV virus can cause myocarditis. Now, when you get a cold and you feel down and out, you feel weak and you feel tired, I wouldn't assume that I got myocarditis. Not really. More than likely, your body is trying to recover from this. And so don't think that every time you get a cold that you're going to have heart problems. No, just know that it is a risk factor. Bacteria can cause myocarditis. Staph, streptococcus, these are pretty common. Most important, what people don't know is the tick-borne bacteria that causes Lyme disease. Myocarditis is is a complication as a result of Lyme disease. We all live in Michigan, Minnesota, Wisconsin, and we all know about ticks. We all know about Lyme disease. That is a side effect causing myocarditis. Parasites, we'll never see these. They don't reside here in the United States, rarely, if they ever do. But fungus, Candida, aspergillosis, histoplasmosis, these are all causes, and usually as a result because of someone has a very weakened immune system. Now, I had brought this up in a previous discussion because people may have heard about black fungus that's occurring in India. At least that's what they're terming it, black fungus. And what they're finding is people who've had COVID and who undergo the treatment, they're finding fungus infections concurrently. And the reason is individuals who get COVID, let's say they have diabetes. Diabetes is a pretty well-known, worldly-wide disease that, affects a lot of people. And India, with a population of 1.3 billion, they have a lot of diabetes there. We're looking at the total number of diabetics. They vastly outnumber the United States, if you believe that's possible. But we know that diabetes does weaken your immune system. And so having a weakened immune system to begin with, getting COVID, going to the hospital, what's the first thing that people are given is typically huge mega doses of steroids. And so to help suppress all of the inflammation that's going on, but that also severely weakens your own natural immune system. So as a result, people in India were seeing huge numbers, not huge, but they're seeing cases of this black fungus, and now they have to treat another type of infection. And this fungus can actually cause myocarditis. And so if there was ever a combination of worse diseases to occur simultaneously, to have COVID and this on top of that, and diabetes and all the complications that can come with that, it can be pretty devastating. So you may have heard some articles regarding that. And obviously drugs, medications can cause it, allergic reactions, sulfa, penicillin, illegal drug use can cause it, as well as chemical and radiation. And then other autoimmune problems like lupus, Wegener's, these are all, autoimmune problems, and Takayasu's arteritis. So these are all these are causes of myocarditis. Now, I will say 1 in 2 chances of getting myocarditis are 1 in 200,000. To put in a relationship to this as a comparison, getting struck by lightning is like 1 in 500,000 chances. I mean, so it doesn't happen very often, which tells you don't play golf in the rain. And the other is myocarditis is a rare occurrence already. So there. Now, the other thing I wanted to bring up real quick before we get into some numbers is this growing urge to answer this question about your immunity. How long is your immunity going to last? It's still an open question right now. And this does relate to the idea of boosters. Now, the general sense is you get vaccinated, you develop an immune response. How long does that last? 6 months, 9 months, 12 months, 18 months, 2 years, lifelong? We don't know. We don't know. Now, what is interesting is like the polio vaccine or measles, mumps, and rubella. These are vaccines that are lifelong. Rarely would you ever need a booster. You don't need a booster. I mean, that's how effective these vaccines are. So can we equate COVID vaccine to polio or measles? I don't know if we could do that just yet because we just don't know. This is really a new vaccine and an immune response. But it's important to understand we just don't have that answer yet. I think we're close. Now, if you think back to the Pfizer and Moderna, there were a big cohort of individuals that were enrolled in those clinical trials. It is that cohort of individuals that are being tested even now. And so they were in the clinical phase 3 trials of these vaccines. Now they're being followed over time. It's this group of individuals that we are following that will determine how long their immunities will last. Right now, it's clearly 6 months without a problem. But at this point, we're getting close to 12 months from their vaccinations. And so I'm sure there's data that's going to come out that's going to say 9 months, their immunity is still effective. I think when we get to 12 months, we'll say, yes, their immunity is still effective at 12 months. Could it be 18 months? At some point, will our immunity start weaning down? I think in healthy individuals, relatively healthy, I think there's a good chance that these vaccines can cause a lifelong immunity. What researchers are starting to identify is that the older population, or the individuals that have a weakened immune system to begin with, their immunity is waning perhaps faster than what normal healthy individuals. So with that first variable, that first question to do, boosters, that has yet to be answered. The second part to this, what kind of complicates everything, is the notion of variants that are occurring. We know about the UK, we know about South Africa, we know about California, the New York, the Andes, the Brazil, and so I'm hearing about new variants that are coming out. There's one in possibly Japan, Taiwan, and even a mutant variant to the variant that was in India. And so what are these variants? How are they going to play into this? Because up to this point, we know that individuals who get vaccinated, even with Pfizer and Moderna, have really high effectiveness against the UK and the South Africa. And I presented this paper before. So both of these variables are just hanging out there that we don't know about just yet. It seems like almost every other week we're hearing about new variants across the world, and these are real things that need to be addressed. So where do these two interact, and what we currently know about our vaccines that have been given? Will there be a booster? Yeah, more than likely. Is certainly the high probability that we will need it. When will that be? I couldn't tell you. Could it be this fall? Maybe. Could it be next spring? Maybe. Could it be 2 years from now? Possibly. And so much research, so much science is going to be created between now and when that determination is. It's just going to be, we're going to not play it by ear, but we're going to have to wait and watch what's going to develop. So when we talk about the variants, and the variants here in Wisconsin, of all of the new cases of COVID that are occurring, you could probably get with a good sense with this statement is about 25% of all new COVID cases are of a variant cause. Now, the upside to saying that is that if there is a variant cause, more than likely more than likely, it is going to be the UK B117. So in the state of Wisconsin, the number one variant here is the UK B117. And just like I mentioned, the Moderna and the Pfizer vaccine are effective against the B117 as well as the South African, not only in preventing infection, but even if you do get it, your the effectiveness against severe disease is almost 100%. And so Pfizer and and Moderna have proven to be effective against the leading variants that we know of. So just another quick reminder to get vaccinated. All right, so as I mentioned, we talked about India. We see India worldwide scenarios that are playing out in real time. Their trend is starting to go down, and actually going down pretty rapidly. So India is well on their way to getting back to that baseline and hopefully recover from this huge surge of infection. Here in the United States, we see this kind of creep of decreased numbers of new cases that are occurring for the last 6-7 weeks, and we're now down to about less than 23,000. So it's certainly not. I'm not going to say the pandemic is over, but it is a quick reminder that it is. Our society is improving as a result of the pandemic. And so now France and Brazil, these are the third and fourth leading countries in the world with the number of COVID infections. Brazil, number 3, has this plateau, and they really don't seem to be getting better nor worse. They're just on this plateau that they seem to not be able to get off. France is on a downslide as well, and the number of the average of infections occurring there is about 10,000 a day. So it sounds pretty good for France when early on when they had their horrific surge way in the beginning. It's still more cases now than back then, but it's just we know more, we can treat this better. And most cases now tend not to be in the severe mode. And I'll bring up a few slides indicating who gets hospitalized and who doesn't. So in Israel, we see the numbers, just this lull of numbers in Israel. Israel is now they're about 77% of their country has at least single dose vaccines, 18 and older. So you can see the impact of immunizations in Israel. In the UK, what's interesting about the UK, at least recently, they're touting they have about 75% of the country, their population has had at least a single dose to date. But in the last week, they've seen an uptick in the number of cases. And so this may be just an outlying point in time, because tomorrow can certainly be different. The numbers could dramatically go down. But as societies start opening up and more communities start engaging, people start engaging more and more, that risk of potential infections can go up. And so what's going to be important here in the next couple of months is how we as members of a community utilize that our own individual responsibility to get vaccinated. So looking at what's occurring here in Wisconsin, 47.9%, almost 2.8 million people have been vaccinated, single dose, minimum single dose, a little over 58,000 individuals, ages 12 to 15 have had at least a single dose vaccine. On the left-hand side, you see the single dose and the rate of individuals, the number of individuals that have gotten by race and ethnicity group to date. What's interesting is when you start looking at, you start looking through the weeds here a little bit and you start looking at numbers a little more closely, you see the number of single doses in the past week. Now, in the left-hand corner, you see the yellow, bright yellow highlighted days by race. And then as we get to May 19th, May 25th, I changed these colors because it was a change in the number of single doses being given by race. So Asians, Black, White, Hispanics all had a bump increase May 19th. And on May 25th, all races had an increase as well. Now, I posed this question to a group this morning and says, why, what happened? What changed? Why is this all happening? I'll spare you the suspense. The one thing that happened was the approval of 12 to 15-year-olds were eligible to receive the Pfizer vaccine, and that's exactly what we see here. We have a bump. Now, come June 2nd, as of yesterday, we see those numbers absolutely start decreasing. Almost as if you took out all of those kids, we look at the natural progression of what this would have occurred, we would have said, well, if that didn't occur, would the trend have continued to go down? And more than likely, the answer is yes. That trend would have continued. So this is a blip, kind of a what do you call that? A road bump, speed bump that we went through. And yes, we did get a bump in the numbers, and then we went right back to where the trend would have been if this had not occurred. So that's single dose. What about our rate for fully vaccinated? We're now at 42.1%, and we see that all races and groups, ethnic groups, continue to increase. When we look at the rate of what's going on here, the vaccines that are being used here in Wisconsin, we see Johnson & Johnson's really not getting much momentum or traction in its administration. And in fact, probably from a week ago to today, I would say Johnson & Johnson is the least used vaccine, with maybe about 5,000 doses given out in the last week. Now, Moderna and Pfizer saturated everything. They're well into every community. If we look at the middle bar, we see that almost 5.2 million doses have been administered, and that essentially averages out to just almost 13,000 doses per day. If we look at the trend of what's been occurring over the last several months, over the last 6 weeks, we see that trend is continually going down. And I wanted to bring this up. There we go. All right. So I've been following this for the last couple of weeks, mainly because of the introduction of the eligibility of 12 to 15-year-olds. We see that on May 19th, that the average number of 12 to 15s was 3,267. The following week was 3,638. And as of this week, we see now the trend is 1,480. So there was a bump up and then a dramatic drop in the number of doses being administered to kids. Now, if we took that away, if we took that average of 12 to 15 out of the equation here, as if we were still doing 16 and older, we would see that on May 19th, the average would have been 21,000. On May 26th, it would have been 20,000. And if we took out the kids this last week, the 7-day average of administering the vaccine would have been 11,500. So you can just see that the amount of vaccines being administered is just really, really, I'll be blunt. I mean, we know each other now. I mean, it's just tanking badly. And so it's not just here in Wisconsin, because when we look at the CDC and look at the map that they track in terms of trending, we see that exact same pattern occurring in months since basically April. The trend has been decreasing, and then once we get to about mid-May, third week in May, we see a bump up. Well, that bump up was the eligibility of including the 12 to 15-year-olds. Now that they have, at least the early adopters of getting the vaccine, they've gotten it. Now we see a huge drop. And so when we look at the two segments, before the bump and after the bump, you can say it kind of looks the same, but my concern is that rate of decline, that rate of administration is accelerating, is going to be more dramatic than what happened before the bump. So it's concerning because, you know, time will tell how this is all going to play out, and certainly in the next 4 weeks up until July 4th. What is this going to look like? Is it going to be the same? Is it going to plateau and be steady? We just don't know right now. Now, I've presented this a couple times, and I'm going to bring it up again because I was pretty close in my estimation. Now, herd immunity, this is that critical threshold of 70%, what is kind of generally accepted now as that rate, that point at which either society is either vaccinated or have had COVID, where the virus starts diminishing its transmission and contagiousness. It's at that point, 70% of society, where that would occur. Now, here in the United States, there's 325 million people. That critical threshold point is to either have vaccinated or people who have been infected. That number is 228 million. That's 70%. Now, when the announcement came out that, you know, July 1st, you know, the goal was 70% will have at least single dose vaccines by July 1. Given when that announcement was made, and I kind of looked at the rate of vaccinations that were occurring, when that statement was made, I felt that we would need about 48 to 50 million new individuals to be vaccinated to make that 70% by July 1. Well, I calculated it out to be about 62 to 63% of people by July 1. And I think I'm pretty much on line with that, because when you look at this graph, the statement at that time was for 18 years of age and older. This is as of yesterday, 62.9%. Now, that is as of right now, today. We know either you get Moderna vaccine today, you're coming back in 4 weeks, and then you get your second shot. Well, it is already June 3rd, 4 weeks from now. As of today, you would just make that cutoff to be included in that 70%. Well, when we talk about immunization, and this is where public health messaging is absolutely important. You have to be precise. You can't talk about half things, half truth. You have to be clear in what you talk about. So when I talk about vaccination, I am talking about fully vaccinated. So that means people need to be vaccinated 2 shots, and you're really not fully vaccinated until 2 weeks after your second shot. So we're well within that margin between now and the time past July 1. So even if everyone gets a shot right now, by the time July 1 comes, they will be fully vaccinated, and that will be 62.9%. We'll just round it up. Nice number, 63% will be July 1. We're short, and that's really going to push back the date is when do we actually reach that? Well, if you look at the rate of immunizations right now, holy moly, I mean, we may be looking at well into September or even October. If we're, that's what we're looking at, maybe even December. We may not even hit 70% until December at the rate of decline that's occurring right now. Now, when I think of herd immunity, I don't think about just 18 years of age and older. I think of everyone. So that's newborns to 120. That's the total population. We don't talk about communities as being just 18 and older. We talk about everyone that is in it, that make up the community. So that's the total population. Now, between now and July 1, I estimate anywhere from 18 to 19 million doses will be given between now and July 1. What would that give us as a single dose? That would give us maybe 57% of the population may get that definition. So July 1, if you look at July 1, 4 weeks after July 1, we're talking about August 1. So whatever occurs July 1 will be what they're fully vaccinated 4 weeks later. August 1, 57. So you can just see how this is not going to work. This is not, we may never even get to 70% is what I'm getting at. And so what does that do about the sense of not only what I presented earlier about immunity and the sense about where we're going to go with boosters? This all plays in. This all plays into what's going on. So it was kind that my senior public health advisor found these data graphs, and I wanted to bring them up because this also came up and he says, well, we're looking at everyone who's just gotten vaccinated. What about all the people who've been vaccinated? Who've had COVID? What about them? Do we include them in this number? And we should. The problem is no one has that data. So no one can actually extrapolate that information to say how many COVID have recovered, are they included in this? Well, they should be, but we don't know, because are we saying just co-vaccinated people, or are we talking, what about the people who've had COVID, who've had vaccines? Are they in this number as well? And the answer is yes. And it's just this mix of all these people, all these numbers. We're not talking about 1,000 or 2,000. We're on the order of like maybe a couple million people who've already had COVID, have gotten vaccines. And so we can't just stack them on top of what we currently are, because we just don't know the ratio of what these individuals have done. Now, the flip side to this is there is data information slowly coming in about what is occurring right now. I had mentioned the U.S. is averaging about 23,000 infections a day. But where are these infections coming from? Well, what we're finding out is it's not individuals who are vaccinated, that's for sure. What we're seeing is the infections are coming from the population that have not been vaccinated. The unvaccinated population is now showing to kind of continue this lingering of COVID, unvaccinated individuals. So when we look at, this is data sets from Maine, Colorado, Washington, and Oregon. So that difference between the rate of per 100,000 to the unadjusted for vaccination. So when we talk about unadjusted, we're talking about the unvaccinated portion of people who are getting vaccinated. And what we're seeing is the better portion of people getting infections are the unvaccinated people. That's basically the bottom. I mean, it's not rocket science right now. It's just putting a number to what we're seeing, and the number is saying the majority of people who are getting COVID are the unvaccinated people. I can't say it any simpler than that. But what about hospitalizations? Well, we're seeing the same thing too. The rate of hospitalization is predominantly the result of people who've gotten COVID, but are the unvaccinated individuals. That's what we're seeing. What about fatalities? Well, again, we're seeing the majority of cases that result in fatalities are individuals who have been unvaccinated. So now we're starting to see some real data information from all over the place. So data sets are starting to come in, and we're seeing in real time. I mean, never has this really happened like this, where you have real-time data answering real-time questions on the fly as we go. And we're seeing, well, this kind of helps answer that question. The COVID rates in the United States are the result of unvaccinated individuals. The rate of hospitalizations, the majority of hospitalizations are related to unvaccinated individuals. The rate of fatalities as a result of COVID are individuals who have not been vaccinated. So obviously there's a common theme here. Risk of infection, hospitalizations, and fatalities are predominantly seen in the unvaccinated population. Plain and simple. I don't know how else to say that other than getting that point across, but that's what we're seeing on a regular basis. Now, let me give you some good news. So what's going on in Indian country right now is in the past week. So as of June 1st, the past 7 days, Indian Health Service, IHS, has seen 342 new infections. That's only almost a 40% decline in infections from the week prior. And now we're starting to see a pattern starting to develop. This is 3 weeks straight now of downward numbers, and overall trend in Indian country is on the downside. That is the good news. Now, if we get a little more closer into the Bemidji area, we're looking at Michigan, Minnesota, Wisconsin. I circled the number, at least the latest numbers. So in the past week, Michigan has seen 30 new infections, Minnesota 36, and Wisconsin 10 new native infections. Now, I know we all have good memories, but to tell you the truth, the last time I saw numbers this low was a year ago. That's how long ago this is the first time we've seen numbers like this, but 12, 13 months ago is when this was occurring. So, and it seems to have kind of dramatically dropped in the last 2 or 3 weeks. And so that's important to know and to see how this is all playing out in real time. And that's one of the reasons why the town hall was even created, was to give people real-time information of how this is impacting not only their states, but their communities, and how this is all playing out. Now, I mentioned the 7-day average here in Wisconsin, 162. It dropped even further as of yesterday. It's even lower today than it was yesterday. But as of yesterday, it was 162. We haven't seen 162 since May 21st of 2020. That's more than 12 months ago. We haven't seen that type of 7-day average. And we all remember what was going on in May. We were all running around like chickens with their head cut off, and lockdowns and all kinds of stuff, and skies falling and everything. Well, fast forward from May of last year to now, 162, we kind of don't even blink an eye like this. What's the big deal? So, everything's relative. And when we look back in history here, today's 162, certainly a lot different sentiment than what was 160, 13 months ago. So keep that in mind, where you were 13 months ago, what was going on then to what we're doing now. We learned so much by then. We've learned a lot since then, and so things are different. We don't see the same number as being so impactful, and so things are different now. Numbers are different. Our behaviors are different. We've been vaccinated, most of us. So, all right. So I've shown this, but what I really want to get to is basically this is just a quick look at saying where are the infections, where are they coming from? The two biggest groups, the 10 to 19-year-old and the 65 and older, basically the 60 and older. Those are the two main groups that show are the number one, number two. And what we see in comparison by the check marks on the lower half is 184 in the 10 to 19, and then in the yellow, 196, comparing that to the week prior, dramatically down. Dramatically down, but it's dramatically down across the board all over the place. So that is good news. So what I really want to get to, and so this point is going to be important because I feel it's important when we talk about the Native community. We're really close. We are really close to kind of breaking the back of this virus, especially in Indian country and here in Wisconsin. We know, and I've talked about this, the risk of infection is really low in our kids. Even the hospitalization is so low. ICU fatalities is almost non-existent. But it doesn't, the vaccines have been approved for 12 and older to this point, and people have been getting vaccinated. And at some point, the age group is going to drop again. But what we're seeing is the vast majority of people, the older age groups, have been vaccinated with lesser degrees as the age brackets go down. We're going to see at some point the rate of infections is going to impact the age groups that have not been vaccinated. So while the most serious of infections were the older age group, that is becoming less and less. What's going to become more and more is the younger population that are unvaccinated, and we have yet to see that kind of pendulum swing from older risk to younger risk. Is that going to be a real entity? And I feel that is, because the longer the unvaccinated individuals go, the risk of infection, you can't dodge this every day until we declare this over. It's going to be, there will be people who will be virus free, yes, but that is going to become less and less with more and more time, which basically means we need to continue the effort to vaccinate. And that's exactly what we're going to do. We are going to host our third campaign, vaccine campaign. It is set for June 22nd. And this is a Native only vaccine event. So we're talking about individuals that are enrolled tribal members and household members that or descendants of ages 12 and older. Okay. The vaccine is going to be Pfizer, and we are going to incentivize this event. So we have people who are contributing, who are sponsoring. Creative Health Collective, Bay Bank. We're looking at other Native organizations, Oneida organization here in Milwaukee, as well as ICS, Dry Hooch, GLIC itself. We're looking at food boxes and household items, personal household items, items for children, kids, infants, diapers. We're looking at providing gift cards for both child and adults who receive vaccines that day. We're going to have drawings for prizes for both child and adults who get vaccinated. And one of our huge supporters of this is Wade Fernandez. Many people may know who Wade Fernandez, nominee from Wisconsin, Music Awards, Native Music Awards, very dynamic, very inspirational musical icon in the native world. He will be here. He'll be playing while this day is occurring. So what's really different about this is that we are being approached by more and more Native organizations to participate, because we all feel that the urgency here. We're really at this point of making a dent. And now that school is starting to wind down, school next week is more than likely the last day of school for most kids. I know it here in MPS in Milwaukee, that is. What does that mean? Well, that means summertime. That means family get-togethers. That means cookout, social events, get-togethers. Traveling. People want to travel. People want to get back into their normal. People want to get back to their cultural and traditional activities that they've been so accustomed and used to doing. Well, this is that opportunity. This campaign event, June 22nd, is that effort for the Native community. And I'm not talking about just here in Milwaukee County. I'm talking about wherever this message goes, if it goes to Indianapolis, if it goes to Detroit, if it goes to the UP, if it goes to Duluth, Minneapolis, even St. Paul, Iowa, wherever this message goes, if you're in the area in Milwaukee on June 22nd, come find us, call us. We want you to pre-register. If you're in the area, we'll get you and your children 12 and older vaccinated. And so that's the big announcement. Jeremiah, you have any follow-ups, any discussion points?
One question. What's up?
Any chit chat?
Yeah, do want to get to one question. You brought it up. I'm glad you showed that slide. Was the one just talking about case rates that have been rising in different states across the country, and a lot of those have been attributed to unvaccinated folks. Do you see? Do you foresee maybe some sort of breaking point where that there would be such of a large spike that would maybe convince those that are kind of sitting back and saying, hey, I don't want to get vaccinated, blah blah blah. Do you see that could be a possibility, as if, hey, okay, all of a sudden you start to see these huge spikes, and they're primarily attributed to unvaccinated folks?
Well, I think with time here, and these states are collecting more and more data points and comparing, people who have had COVID. The question now is, are they vaccinated or unvaccinated? And that data points, the more infections that come in, the more we'll be able to answer that question. So what I hope doesn't happen, what I hope doesn't happen is that we get a surge, and we all the progress, all the decline in infections and so forth, we get to this point where we can't kind of break the ceiling or the floor on to get past, and we start seeing an upswing again. It is going to be that upswing that, if that occurs, would be a clear indication that this is by far not over, and a quick reminder to populations that getting vaccinated is still the critical aspect of overcoming this pandemic, without a question. The states are starting to show numbers that are, all of the numbers that they're seeing are attributed to unvaccinated individuals, whether that be in getting COVID, and hospitalizations, and fatalities. The numbers are starting to show, without a doubt, this is all occurring in the unvaccinated population. And just, it's great that we're seeing the decline of numbers here in the United States. But at the same time, because we are still seeing and diagnosing people with COVID, it's just a stark reminder that this is not over. I know the CDC came out with its mask guidelines, face mask guidelines, and I know people are chucking their masks right now, but is it premature? I don't know if you want to say premature, but the numbers certainly is a good reminder that this is not over.
So I just want to mention, regarding the vaccine clinic event, and people might have this question overall, obviously we're doing another big push on that day, June 22nd. If you're, in the Milwaukee area and you can't make that date, is the Gerald L. Ignace Indian Health Center still offering vaccinations to not only natives, but just folks, members of the community?
Yeah, no, absolutely. But I would emphasize, do try to make that date. We have been vaccinating, scheduling people even right now. So it's not absolutely critical that you make the 22nd. If you want to, we'll find a date. We'll find a way to get you and your family vaccinated.
And two, there is obviously stipulations now that with, being 12 to 15 years of age, you do need to have, parental consent. What does that entail for a family of, a child who's in that age range? Who needs to come, and, what do they need to bring with them?
So, when you register, obviously if you're an adult, there really isn't any issue about consent. But when we're talking about individuals 12 to 15, yes, a guardian, a parent will need to come accompany the 12 to 15-year-old, because the parent is going to need to provide that consent and approval for individuals to get vaccinated. Because they are minors, we won't accept individuals who approach us on their own, who happen to be 12 years old, asking for the vaccine. We will not be able to offer that. So it's important that either a parent, both parents, or a legal guardian accompanies the 12 to 15-year-old, and signatures will be required to give consent and approval for the vaccine.
All right, we're coming up on, a little after the 4 o'clock hour, so I'll let us go for today. But, as always, I think thank you from the community for, throwing another one of these events. I think it seems like it's needed. And hopefully that can get, some of those people that maybe have been on the fence out to the clinic to get vaccinated. But with that, I'll leave you, as always, with the last word. And thank you again, Dr. Ignace.
Yes, thanks, Jeremiah. So we're really close. As I showed in Minnesota, Michigan, Wisconsin, the numbers are declining. But we're kind of at that point where you can't rely on the other person to get us over the finish line. It really will come down to individuals who may be on the fence, who are hesitant, who, are reluctant. I can't say this enough. We are offering this for our families, for our Native communities, for our children, wanting to get back to that normal way of Native living. This is your opportunity, June 22nd. So please call us. The number is here, 383-9526. It's open today as of 3 o'clock this afternoon. So please take full advantage of what we can provide. And nobody to date has regretted getting vaccinated. So until next time, everyone, stay strong.